Neuromuscular stimulation with in a mechanical way. The first thing is here that you just see what kind of devices we have. So we have standing devices, but we have also devices for people who are not able to stand, like tilt tables for stroke patient, MS patient, spinal cord injuries. And we have also small tilt tables, which we, for instance, use for children with neuromuscular diseases. And we have a dumbbell for the upper extremity, where, for instance, we can reduce the spasticity in the arm in a stroke in minutes. Just that you see where we can use this. So we use it in osteoporosis, in back pain, in geriatrics, in neurology. In neurology, like spinal cord, stroke, MS, decreased mobility with lung disease and COPD, decreased mobility and pain reduction with chemotherapy in oncology, children with neuromuscular diseases, or in sport injuries. The first thing is we need to understand is that there are only two ways to stimulate the neuromuscular system. So we have either electrical stimulation or mechanical stimulation. Mechanical stimulation means everybody knows this patellar-tendon reflex. What we basically are doing, we are elongating the muscle spindle. The muscle spindle sends a signal to the spinal cord and activates the muscle. So in opposite to electrostimulation, where we primarily stimulate the nerve to the muscle. So in electrostimulation, you can generate a strong muscle, but not a very functional muscle. With mechanical stimulation now, you have afferent, efferent, and the muscle. So we are stimulating the neurological system and the muscle system. And what is also very important, all the afferent signals goes up to the brain for stroke or brain injuries or CP-killed children. The basic effect what we are using is a side alternating movement to activate not only the legs muscles, but really the complete muscle chain, the leg muscles, the pelvis muscle, and the trunk muscle as a complete muscle chain. And this I show you now on the Galileo system. So who wants to try once the Galileo system? Okay, come slowly upright, come upright slowly, then you feel more and more your back muscles. So give me your hand, go on your toes, and this is out of your back, it's less in your back. Yeah. Now go down again, it's in your back. But there's no vibration here on this level, very little. And how important this is, I show you now. Now turn 90 degrees, like this one, and go backwards, and you see what happens on your brain. So now activation of the back, and so we are not walking like kangaroos, but we are walking side alternating. Therefore, it's very important to have a side alternating movement. The stimulation effect, like I showed you before, so what we're doing, we elongate the muscle spindle. The muscle spindle sends a signal to the spinal cord and activates the muscle. And now, independence of the leg position, so if you're more flexed, it's more in the legs and in the pelvis. If you're more upright, it comes also to the trunk. And the stimulation effect I show you now on the spinal cord. This is somebody who was in December 2011 injured C6. And you will see now that he is not able to control his legs. He has spasticity, and he is not able to support his own body weight. But in the moment we start the Galileo system, he is able to straighten up by inducing these stretch reflexes. He can hold his own body weight by inducing these stretch reflexes. And now after some seconds, the machine will stop, and then you will see that he will collapse. So now the machine stops, and in the moment the machine stops, comes now, he collapses. Now we restart the machine. The mother is bringing the foot in contact again with the platform. And when we induce these stretch reflexes again, then he can straighten up again. And this is now June 2012. And just that you see what happens, April 2013, in his case, and obviously he was incomplete. With a complete spinal cord, it would not work, but he is incomplete, and he has regained the functionality to walk stairs again. So without having a stimulation device and training the neuromuscular system, this would be normally not possible. And now we come to an important topic, Galileo and the frequency, why we have chosen the frequencies. And the first consideration comes from the muscle side. The muscle needs about 25 milliseconds to contract and 25 milliseconds to relax. In total, 50 milliseconds. And if you divide 1 second by 50 milliseconds, you end up by 20 hertz. That means if you have a frequency below 20 hertz, the muscle can still relax and contract. If you are above 20 hertz, the relaxation time is cut off and you get a more and more higher muscle tone. The second consideration comes from the neurological side. So if you elongate the muscle spindle here, and the muscle and the signal runs up to the spinal cord and goes down again. So this loop takes also about 50 milliseconds and corresponds also to 20 hertz. And the third consideration comes from the central feedback. That means the communication time between the foot and the brain. And this takes about 80 to 100 milliseconds and corresponds to 10 to 12 hertz. That means if we are with the Galileo frequency below 12 hertz, then our brain has to compensate this side alternating movement. If we are above 12 hertz, then we have the spinal feedback system. I show you now the difference between the spinal feedback system and the central feedback system. Who wants to do a one-leg stand on the Galileo? Balance, one-leg stand. Come, yeah. Go on the zero with 1 foot and try to balance. So I start now with 18 hertz. So then he's normally quite easy because we have the spinal feedback system. You don't have to think about it. It's normally, and now if I go lower below 12, then now we have 14 hertz, 13 hertz, 12, and now we come below 12, and now it's getting more and more difficult. Now he has to think about it. You feel this? Yeah. So if I go high, then it's easy. Then we have the spinal feedback system. If we go low, then his brain has to take over, and it's getting more difficult. So he has to think about this. Okay, thank you. So stay here, stay here. So the next thing I show you is now the frequency above 20 hertz. Now go between 1 and 2, both legs, both. So now I go to 18 hertz. Now you go in the skiing position. Okay, deeper, okay, like this. And now I go above 20 hertz, and then the muscle tone getting higher and higher. So you can confirm this, that the muscle tone gets higher? Good. And if somebody wants to feel, it's really now tight muscle. But, and this is very important again in rehabilitation, we can work on the muscle in the neurological system without affecting the heart. Heart rate stays normal and lung function stays normal. So there's no impact on the cardiovascular system. This is very important, that we can train the high muscle power without affecting the cardiovascular system. And we do this now for 1 minute. And so this, the other very, yeah, it's getting hard. So another 30 seconds. And then when you step off, you are much better coordinated. So a lot of therapists using this technology in front of any functional training. So first they use this, and then they do treadmill training, or they do stretching, etc. So this makes it for the therapist much easier to do stretching exercises or functional training exercises. So 15 seconds, and then I stop it. And what happens due to the high muscle tone, the blood circulation in the muscle is reduced, and then the muscle gets more and more tired. So I will stop it now. And now walk, and you are like new. How you feel?
Very light.
Very light, yes, very light. So therefore, we divide the frequency range in 3 parts. So we have the lower frequency, where we use for balance, mobilization, proprioception. We have the medium frequencies, where the muscle still can contract and relax, which we're using for stretching, muscle function, and coordination. And then we have the high frequency, which we're using to build up muscle and to reduce spasticity. So an independence of the frequency, we define the training goal. The second parameter is then the foot position. So the foot position gives you the intensity. So the frequency determines how the muscle has to work. The foot position determines the intensity of the training. And normally we start with a small foot position, and then we go wider. And that just you see that we are really stimulating the neuromuscular system. This is now from the sports field in America, where they have put 2 EMG electrodes here. And he's standing on the Galileo system and he's doing a squatting exercise. And first the Galileo system is off. And I start now this video. So he's now doing the squatting exercise, but the Galileo is off and you can see the 2 EMG signals here from the 2 muscle groups. And then now here, they will start now the Galileo. He's continuing doing the squatting exercise. And now you can see the signals with Galileo, and you can see the same movement with Galileo leads to a much higher muscle activation. So doing the same exercise on the Galileo has a much higher impact on the cardiovascular, on the muscle system. When we talk about motor learning, we know that it's needed repetition, repetition, repetition. So learning walking means 3 million steps. Playing professional instrument or sports, again, millions of repetition. And the Galileo helps you now to lead to a better neuromuscular communication. That means if we work with 25 hertz, that means 25 muscle contraction per second, 1,500 muscle contraction per minute, or 4,500 muscle contraction in 3 minutes. So here you get the repetition rate, which is important to get a better neuromuscular communication. Of course, it's not replacing walking. So walking you have to do, but to condition the system to have this high repetition rate, here the Galileo can help you again. And then we have a special function, we call it the wobble function. That means when we activate the wobble function, then the frequency is changed randomly, and there are different levels. So for instance, if I go to hard, that means plus minus 5 hertz in a shorter time. So the machine is changing the frequency randomly, that the neurological system has to adapt on these different frequencies. And later on, if you want, you can try this on the machine. And then the other aspect is that this training is probably one of the safest way to train the neuromuscular system. So the loads on the joints and ligaments are less than walking. And this is shown here. So if you do one leg hopping, if I do this here, I do about 3 times my body weight. If I am walking, I put more than 1 time my body weight on one leg. And if you are training on the Galileo system now, independent of the frequency and amplitude, the loads are always below daily exercises or daily movements. And then there's a nice study from the Charité in Berlin where they have used this in patients with artificial vertebra, artificial knee and artificial hip. And here they have sensors inside where they can measure the loads in the artificial joint. And then you can see here again walking on hip and knee level, and this is during Galileo training. And again, the loads which we are inducing are less than walking. And that's the reason why we can even train children with osteogenesis imperfecta, with brittle bone disease. So this is a child who is doing the training at home. She's about 8 years old. She has this osteogenesis imperfecta, brittle bone disease. And she's doing the training twice a day at home. And at the beginning, she started at a quite low level. You can see now that she started in this position. And then after a certain while, she was improving in a higher position. And especially in these children, it was very difficult to induce any strength in the system. And so this girl was not able to sit or to stand or head control. And then afterwards, after some months, the child was able to sit, head control and trunk control. This shows you that you can even safely train these children with brittle bone disease. So now, if you are interested, who is willing to come, can try this machine. And if you want it, or you have questions, just tell me. There's much more research. This is just showing a little bit of this. But who wants to try, you can try it now.
This was quite intriguing to try out. Very good. Do like it.